This is our blood vessel, and these are our cells. Okay, so we said that, so here we've got our intracellular fluid. Intracellular fluid. This is our interstitial fluid. So then this side we have intravascular fluid. Now we know that there's a constant movement of water between these compartments, and we said that the force that is responsible or that takes water from the intravascular out into the interstitial space is the hydrostatic pressure. Hydrostatic pressure. And there is a force that counteracts that one and takes water back into the intravascular from the interstitial space, and that pressure is the oncotic pressure. And we did mention also that whatever fluid that is left there that the oncotic cannot take it back to the intravascular, the lymphatic vessels, they drain that excess fluid into the thoracic duct and then into the subclavian veins. So in the event where you cannot, okay, let me put it this way. As long as the water that is taken out of the intravascular into the interstitial, as long as most of it comes back, is pulled by the oncotic pressure, and the little that is left is drained by the lymphatic vessels, you won't have excess fluid that remains in the interstitial space. But there are times when you've got excess fluid in the interstitial space. There are times when you've got excess fluid that is in the interstitial space and it can't move, or it can't be drawn back into the intravascular and cannot be taken by the lymphatic system. So the medical term for excess fluid that is in the interstitial space is edema. Edema. So now we can see that you can have edema, which is the excess accumulation of interstitial fluid. So you can have edema because of an excessive hydrostatic pressure, or because of an ineffective oncotic pressure, or because of lymph obstruction. So there are different conditions that give you edema depending on what is happening at this level. So when you've got excess hydrostatic pressure, you will, so if the excess If there is excess hydrostatic pressure and that is not, so it's not, and your oncotic pressure is not compensating for that, and also the lymphatic system is not compensating, then you will end up having water that accumulates there. So what are the conditions that give you an increased hydrostatic pressure? Most of your fluid overload states, they give you a high or an increased hydrostatic pressure. So all your fluid overload states, such as heart failure, renal failure, portal hypertension, and the liver cirrhosis, there are so many of them. And also a situation where there's sodium overload. People who consume a diet that is high in sodium will develop edema. So there are others. So with hydrostatic pressure, so these overfluid load states, fluid overload states, it means you've got excess fluid that is inside here. That excess fluid inside here will create an increased pressure inside this vessel. Once you've got an increased pressure inside this vessel, these endothelial cells will be stretched open. So there'll be small pores that occur here, and then the fluid will start to make its way through those small openings. Remember, the endothelial cells, they are cells and they are linked together by gap junctions and all of those. So when those cells are overstretched, those junctions will open up, and that fluid will end up will start escaping through those small openings. That's when you've got, so most patients who've got a fluid overload, they've got an increased pressure inside that inside those vessels, right? So this will give you a generalized edema kind of a situation, right? Let's say now you don't have a problem with your hydrostatic pressure, but what you have, you've got a problem with your oncotic. So your oncotic pressure is inefficient. So it means now you've got fluid that has accumulated here, not because there is an excessive hydrostatic pressure, but because your oncotic pressure is not doing its job of taking the fluid from the interstitial back into the intravascular. So we know the major regulator of the oncotic pressure is albumin, right? So your oncotic pressure is weakened when you've got a low albumin. This is very common when you've got hypoalbumin. So what are the causes of hypoalbumin? First of all, it can be that you are not producing enough albumin. Say you've got a hepatic failure, say you have malnutrition, those are the most common ones. Or you can have a low albumin because of renal loss, such as when you've got nephrotic syndrome, when you've got you know, diabetic nephropathy, hypertensive nephropathy. There are so many conditions that cause the loss of albumin in the kidneys. You can also have, so these are the most common ones. Now let's talk about, sometimes the hydrostatic is fine, the oncotic is fine, but the problem, you've got an obstruction of the lymphatic vessels. This is what they call lymphedema. So maybe there's a tumor there, or maybe it's a complication of some procedure, or some operation, that kind of a thing. So these are your general causes of a systemic swelling, right? Now, when you have a localized swelling, another condition, okay, let me just put it here. Okay, sometimes you can have edema, not because you have any of these, but you've got a problem with the integrity of your endothelial wall. Maybe there is a condition that is damaging the endothelial wall or is forcing it to open, like in your allergic reactions, like anaphylaxis, your allergic reactions where you've got histamine that has been released, and there's the endothelial walls, they open up and then fluid escape. Or when you've got infection or inflammation, the endothelial wall, the integrity of the endothelial wall is compromised. Now you get swelling. So most of those, except for the allergic reactions, are usually localized. Cellitis, trauma, burns, all these kind of things, they're usually localized. So with those ones, it's usually because you've got a problem with your endothelial cell wall integrity. So maybe I should just put it here. We just say endothelial wall damage. So these conditions, they usually give you a very localized swelling, as opposed to these ones where there's generalized swelling. So guys, we couldn't like, it's impossible for us to talk about the fluid compartment and not talk about the pathologies that are involved, so that we can understand what is happening. Yeah, so now our next video, we're going to be talking about electrolyte distribution in those compartments. Thank you.